Okay, so good day, sir. I am Miss Judy Tabora, and I will be your student nurse for today. So before we start, we will be identifying the patient using the three identifiers such as the name, birth date, and the age. Sir, may I know your name?
Is Dimujan.
Okay, how about your birthday?
September 25, 2006.
Okay, how about your age, sir?
19.
So before we proceed to the assessment, of course, we will verify the doctor's order to the moistening and the type of moist. It's either hot and cold application, the location, the temperature, of course. And after that, we will be reviewing the patient's chart for any medical history. Sir, do you have any medical history that might cause you discomfort during this procedure? No. Okay, that's good to hear. We will be asking also the patient, sir, do you have any sensitive skin? Do you feel pain or any sensitive pain during the application of cold compress? Or whenever there's irritation, whenever a hot, cold thing applies to your skin? Okay, that's good to hear. And then after that, we will be assessing the patient's skin or the wound area. So we will be checking this patient's wound to any discoloration, the sizes, and then after that we will be asking the patient's pain to sensitivity. So and tenderness. So I will be inspecting the wound first. Sir, allow me to lift the top linen to see your injury. Is that okay, sir? Okay. So we will be exposing only the injury part. Also, I will be assessing the client's family, or I will be telling the I will be explaining the procedure to the client's family, and then after that we will be assessing the client's. I will be assessing the client's vital sign by checking the blood pressure, the temperature, the respiratory rate, and the heart rate. So let's assume that we already did all of that. We will be identifying the. Of course, we will know the expected outcome. If the pain is feeling any pain, the blood pressure should be higher. And after that, we will be assemble and prepare all the equipments. So we prepare all the equipments in the bedside, and then after that is describe the sensation. We will be asking the patient to describe we'll be telling the patient to he will be feeling during the procedure. So, sir, you will feel a cold pain that will touch your injury. Is that okay with you, sir? May I have your permission to proceed with the assessment? Yes. Next, after that, we will be providing privacy to the patient by closing the curtains and closing the door. After that, I will be positioning the patient on the bed and expose the injury part only. Of course, we will be putting we will be perform hand hygiene first and put on gloves. After putting on the gloves, we will be placing the waterproof pad to the patient under the patient's injury. Sir, but of course, we will know the patient's limitation of movement. Sir, can you lift your feet? Okay, that's okay. Okay, so I will be putting this under the patient's injured part. After that, after doing that, we will be using, get the cold compress, of course, get the towel, and let's assume that this has a water on it. So get the towel and moisten it, and then put it on the injured part. So sir, do you feel any pain while I'm putting alcohol first? This helps with the inflammation and okay, after applying the hot compress, remove the moisten and then remove it and wash it, moisten it, and then put it back and do it until I repeat the same step over and over again. After that, check the patient's skin color or the injury condition. So if there is any improvement, so let's assume that there is no more inflammation on the patient's injury. After that is of course we will be stopping the application when the patient feel any uncomfy feeling or pain, or if there is any problem, and then I will be removing the gloves and remove and dispose it properly. Perform hand hygiene, and then help the patient to a comfortable position and comfort the patient as well. Sir, do you feel comfortable? After that, as inspect the body part, we will be also checking the patient's vital signs again, like what we've mentioned before, and of course is document.